Oh, leaf shower.
Nini? Oh yeah. Hey.
Yeah, we see. No, don't stick it. Just keep it even with us here.
Chini tu.
Yeah.
The nini na meltisha gamu yake.
Yeah.
So we are back.
You're good?
Yes, it is hot.
So,
We are headed to.
you may stick up.
You may stick. The dew in a melt.
Yeah.
In a melt, it is remelt, unmelt, remelt. Okay, let's go. Let's catch up at the doulas. Now you know the difference between a midwife and a doula, senior baby. Say assalamu alaikum.
Assalamu alaikum, guys. Does it need a wipe? Maybe it does.
We shall fix our roads. We will not complain. Sindio? We will fix them up. Okay, let's go. I feel nervous. We have arrived at the maternity hospital. So where we've opted for, our option is a maternity hospital. We are here.
Jambo.
Jambo ma'am. Habari ya leo? Nzuri, labda yeye. Pia si tuko salama kabisa. Tumekuja kuona daktari. Sawa.
Tuweke hapa hivi ama tutaweka huko?
Let's go see. You're under time?
Yeah.
To 20.
$33.08.
34,003.
Hapa ni?
So today we hope to get to see our room.
Where the room?
Yeah.
Yeah.
We hope to finally get to see our room and to meet the doula. Go safe? Sawa, asante ma'am. So let's go see her. We are late. Jambo ma'am. Habari ya leo. Thank you.
Jambo, jambo.
Yeah.
Bihodi.
Hi, good afternoon. Hi.
Ni aje? Leo sisi tumerudi. Uko poa? Safi kabisa.
Oh, can you sawa. Thank you.
How are you?
I'm much better. I'm feeling much better. I think, I'm not sure if it was the iron supplement. I got some iron.
Oh,
From here, yeah.
were they new one? New?
Yeah,
Totally
they were
new?
new actually. Who was it? Christian.
Yeah,
Christian is
yeah.
the one who gave them to me.
Okay.
I've carried them.
All right. It's okay. Okay. How I was really concerned that I thought probably it's our usual hormonal, you know.
It was just a lot of fatigue, a lot of tiredness. So
The next
just
day
taking time to rest.
And you got your yes.
Just arrived.
Yeah, with our minutes late, our Kenyan time.
Today I'm actually the one who's gotten us late. It's my bad there. Normally I'm the one who gets us early.
So we're having some lessons.
This is basically your first class or your second class now?
My second class. Our first class was the previous visit where we actually got to cover a lot with doula. We got to understand a lot.
So today it's a class.
Yeah,
Like
today,
I have not understood what the classes are exactly.
let's see. Yeah.
Today we are going to. Last time we covered when and how to tell that you're in labor.
Yeah.
All right. So today we are going to capture what happens throughout labor and what you expect immediately when labor begins. Right. So last week I mentioned about a diaphragm.
Yeah.
Please, I do not want to say you this. This is the one that it's like a pant, it's like an adult diaper.
Yeah.
So I know it's comfortable.
But it'll.
But
yeah.
this absorbs a lot. So this one will not make you uncomfortable when you're bleeding. Because before it is full, and some are even bigger than this. Before it's full, you are bleeding and it's soaking. It continues soaking. By the time it is full,
That's
for
a
you,
lot of blood.
it's a lot of blood. But for you just go, exchange, put up a new one, but you won't raise an alarm. But the usual pad is usually half of this, right?
Yeah, the
It's
normal
half of
pad.
this
Yeah.
to that length. The moment even you get out of bed once, twice, thrice, you'll be like, no, excuse me, is it supposed to be like this, you know? And probably you will miss because it will be all over.
You will
so
be able
that
to notice.
you'll be able to notice and shout for help. We expect bleeding after, but it's usually like a normal menses, especially on the heavier day.
Okay.
Then immediately, within 12 to 24 hours, it should start reducing.
Okay.
No clots, and it should not be a lot. And it should not have obvious pain. The only pain that I expect after delivery is when baby comes to the breasts.
Okay.
When you're breastfeeding baby the first 12 hours, anytime the baby is on the breast, you'll have cramp-like.
Okay.
Which for me is a very good indication because there is a hormone that is produced throughout labor. It's called oxytocin.
Yeah.
It's also produced when baby is lactating. So when it's produced when baby is lactating, it sends signals to the uterus, which is a good sign because your uterus will shrink back to its original shape.
Okay.
And when it's shrinking, you will experience bleeding because inajikunja, it's squeezing. So any blood will get out, which is a plus for us.
Okay.
We want that uterus to be back to its original. That is why we say breastfeeding. If it's not an emergency, there is no emergency resuscitation, baby should breastfeed within 30 minutes. If not immediately.
Yeah.
Yes.
Do we have the option of the very first vaccination that baby is supposed to be administered will be administered within what amount of time after delivery?
Okay, the very first vaccines, actually the very first that is government, it's the eye drop.
Okay.
It's eye ointment actually.
Yeah.
We just put it. This is good because in case there was any infection and any during labor and delivery, at least it will not go to baby's eyes. It's a good ointment.
It's a safe option.
safe option. Okay. The other one that you give here is for bleeding. It's vitamin K.
Oh yeah,
vitamin K is good. It's just for bleeding.
Bleeding. The baby will be bleeding.
No, to prevent any bleeding. If in any case there is any bleeding condition. So that one we will not call it a vaccine per se. Although yes, it's a vitamin given immediately.
Okay.
Then the rest can be given later.
So that vitamin will be given on the arm, on the thigh.
Yes. And that's immediately.
Yeah.
So that's what you're asking, if they immediately were going to get when the baby is born.
And all this, if all goes well, they can be done when baby is still on.
That's what I was requesting for.
Yes.
We would love for just immediately after delivery to just spend the
skin
first
to skin.
Completely
1
no
hour,
detachment.
Golden hour.
If we can have even longer to not detach, like no birthing of baby just for a while.
Good thing. Birthing baby, we encourage birthing your baby after 24 to 48 hours.
Yeah, maybe even after we go home.
24.
Yes, to 48. Yes, there's no emergency. Actually, we are very dirty because your baby is extremely sterile. It's us who are dirty. Yeah, you see all the procedures that we're going to talk about throughout delivery, we are using sterile gloves. Sterile gloves, not just gloves like those ones in a box, you know. It's sterile gloves. Baby is in a very safe condition right now. So once baby is out, we are the ones who perceive baby as dirty.
Yet we pass the dirt.
Yes, and in any case, that's a very sterile place. There's no hurry to wash your baby. Even to clean, we'll just, actually you'll see, we'll just use like a towel to damp, just to damp the baby. This the white substance baby are born with. It is not too chafu. Our great grand, they used to say that is their uchafu, like it's sexual. Now we know what you've been doing throughout your pregnancy. No, and by the way, I hope you guys are having a lot of sex. A lot.
Oh no.
Underline. Underline. Why?
We actually purposefully decided to reduce it to just focus on baby for their sake, for safety of baby.
Just focus our energy on our baby, so that we don't really, we just want to be there for our baby and not be selfish for ourselves like that.
It felt like a selfish decision if we were to continue to
Okay. Allow me to tell you medically, then continue. I hope this helps you look at it differently, but your decision is respected. Right now, you guys having sex and enjoying your intimacy is a plus for you. All right? It is a plus for you. It has extra bonding, extra. Everything is so positive, because were it not even for that, this baby would not be here. Then it's 100%. I don't know what to say. It's 100% benefit for you. If labor does not begin, we induce labor. You get me right? All those medicines that we use for induction and increasing your labor, they have a synthetic hormone that is found in semen. All right? So the more you're having it, you might assume this is the uterus, this is the cervix. The semen does not go in or out. Just the same way you are not litter. You know, water will be following you everywhere. So that means here, it's tightly closed. This is the neck of the cervix. We talk about how it will open. So this place is tight. So even if you have sex, there is nothing that is going to your baby. Nothing. Every deposit is done here, and it will soon fall out. And by the time it is here, it helps ripening your cervix. So it's therapeutic for you. Okay? The other thing is, it helps you as a couple be as innovative and extra. You will look for the positions until you get them, and it will be fun. You know, and you'll be like, you have to give us a query. I mean, it's just a you time. All right? Because right now, definitely the usual, we call it the usual thought of it, that one is out of bounds. So you guys are going to figure out other things that you couldn't have even thought about it without a pregnancy. All right? He can sit and you can sit on him, you can lie on your side and you can spoon, all those signs. Today, that's the assignment that I'm giving you.
Assignment taken.
All right?
Okay.
Then it helps with your bone flexibility. Yes. All right? It is not tight as right now. It is not. And some couples worry that what if I take too long? As long as you're comfortable, as long as you're enjoying it, you won't even remember how long it took. Then the other thing is, definitely right now, the temperature around there is extra hot. You are extra moisturized. Who will take long there? He's laughing. All right? Just go and have it. Then remember we said baby is coming, and baby comes with attachments. You know. So there's so many things that you will do right now that you will not do when baby is around. Oh yes! Oh, life is gonna change. Have this moment for you. When that baby is 2 years, around 2 years, and you want to have your time, Mom, each and every cycle, you're like, how does this baby notice? So have your time now. Okay? Please do. Okay?
Noted on that.
Yes. All right, where were we? At least we discussed this.
That is out of the...
And if your water breaks, as baby has not yet come, and your water breaks and you need you to walk up and down, the hospital will provide this, because we don't want you to buy, because it comes as a bag. You know, just like diapers. So you can just get a piece from
the hospital.
Yes. So, labor has started. I removed the breast, but it's not the time to look at the breasts to discuss breastfeeding, but I want to know how your nipple looks like.
It's actually quite enlarged. Yeah.
And the nipple? Is it like two different types here?
So this one does not
This one like that.
This is
And this one
inverted.
like that.
The nipple is inverted inside. So this is a normal breast that I don't expect it to give us any issue. Yes. But this one, we could have started trying to pop the nipple out at this time.
Okay.
So that by the time baby comes, we are ready.
Okay.
Yes.
Oh, so it's not necessarily something to worry about.
No. The good thing is when we discover it early, as early as now. But when it's not discovered, when we don't examine, the baby is already here. You're wondering how baby is not able to feed. Kumbe, you have the inverted or flat. Okay. I'm glad that we are not there. So.
And this one we just talked about the sex factor.
Yeah,
it was just recently.
Just a few days ago.
Just a few days ago.
Yeah.
It wasn't like that previously, but we just decided this.
Towards the end,
this last trimester is when we decided not to.
Okay. But now you can, when you go home, you can discuss and see if you'd want to review.
I think you've given us.
We were going Kienyeji way, not knowing. Like there was no knowledge, but now we have the knowledge.
Okay, beautiful.
We knew why not, but we didn't know why. What is the benefit?
All right, so it's benefit for both of you. And remember, once baby comes, at least we need to 6 weeks rest before.
Yeah.
You see,
6
so
weeks,
it actually becomes such a long time. Yeah, but definitely with. Like you guys, you are ready for it, you had planned for it. It becomes even easier when a couple discuss such things and they agree to it. So, yes. So, labor has started. So, I'll use this as all this is inside here. Now, see why you're adding weight. It's quite something.
Yeah. It does look like that.
You know? In a very special way.
Yeah.
So, we said when labor begins, this place is, the cervix is closed. Nothing gets in, nothing gets out. Baby is feeding through the amniotic fluid, and anything that is extra like waste, also the same way.
It's excreted like that.
Yes, the umbilical cord. So labor begins, and you have to open and to keep opening, and it's hard work until you're this open.
That's tension.
Yes. You see, so baby's gonna come out from here, like here, like that. Then switches a shoulder, then another shoulder,
down.
and comes out like that. And then baby will be
Interesting.
yeah. So at the moment, our last ultrasound should show us that baby is facing this direction, like that. So you see, because the shoulders are very broad, very broad, all of us.
Yeah.
Same to the baby. And when a mother tears, it's usually not the head,
It's the
it's
shoulder.
the shoulder. Baby must turn so that one shoulder out, then the other shoulder. And then I'm doing this, but it takes less than a second.
Oh.
Yes, to
around.
flip like this.
I thought it's.
You hold the head.
And once the head is out, how long does it take now for everything? Because normally I hear people go 24 hours in
in labor, not in
giving birth.
baby coming out
Yeah.
here.
That one is like how long generally would that take?
Quick, quite quick.
The whole process.
No, the process of baby coming out
Once
is
the head,
fast.
let's say the head is out. Once the head
Then
is
the
out,
shoulders come
that's
out.
like a second. It's just
Like
Yeah.
if it goes so much, it's like 3 minutes.
oh.
Yeah. I'm not even, no, I'm so sorry, not 3 minutes. Once the head is out, baby should be out. It's less than 30 seconds.
Yeah.
Oh.
Because this
Quite
baby has
fast.
started already breathing. So when everything else is inside there, this baby will suffocate.
Oh, it's getting squashed.
Yes.
Oh.
Yeah, it's just a blink of an eye. Yes. Okay. So.
You're ready.
I'm ready.
Should it be scary for her?
No, it should not be scary because one, we now know what you are going into.
Yeah.
Right?
Yes.
Above all, you have to believe in yourself. And look at this. A semen, a sperm in the semen, and an ovum that came together to make your baby. They were both microscopic.
Mm-hmm.
Okay? Then we are here trusting and believing in your body to give us a baby with bones. Bones. Not just the muscles that is being flesh. Bones. What are you telling me? How powerful is that body?
Yeah.
How powerful does that motivate you? That you will bring forth this baby that you made. Remember a sperm in an ovum and microscope. Then you can't see them and see what your body has done. I'm having goosebumps.
It's very special.
Yeah.
It is so special.
And you'll be good.
Oh yes.
I'm ready.
Oh, beautiful.
I'm excited.
So, exactly. So this is the last thing. And then from there, the same body that made these bones and skull, it must feed its own baby. It must produce enough food, enough milk to take care of this baby. Because if it made the bones, what is milk? I mean, what is milk?
Yeah.
You see, the way I want you to realize how special you are. That is it.
I got this.
Yeah. Yes. You got this.
Yes, that's the favor.
Why are you worried? I'm sure it's like I'm taking it as for me as circumcision when I was young. It used to be really scary. It used to be, and I keep telling her until when I went for the circumcision, I was very scared. So I'm assuming it must be the same for her, like because it's unknown, so she must be very. You want to be strong, but there's that small fear that maybe just a word like that is enough to change. Yeah, encouraging.
The fear or the nervousness is mostly just to make sure everything is well with baby. Just let baby be well. Let everything be well for baby.
Right?
And I'm asking if everything will be well with her.
I'm good. I am good for sure.
And I like the fact that he's insisting with you because you are the driver here.
Yeah.
Without you, we are not moving.
Yeah.
We are not. How? Have you ever used a matatu? All right? So, we're all traveling. We get into a matatu. Then this driver gets in and says, am I really ready for this? And you're a passenger. Because I can imagine the passengers will look and we all look at each other like, did you hear? You know, with those eyes of, did you hear what I heard? You know? So you're the driver here. We are riding on your faith. Yes, that's how much we trust you. We are riding on your faith. So show us the way.
Yes.
Huge task, huh? We are all riding.
It will be good.
Yeah.
I trust, I believe it will be all well.
Amazing. All right? And back to this topic. This is the longest journey I've seen. Opening from here to 10 centimeters to allow our baby to do what? Come out. This is the longest journey. 9 months have not been long. This is the longest.
9 months have gone by so fast.
Oh yes. Okay? So, how are we going to know that you're progressing well? There's something that we call vaginal examination. Okay? Have you heard about it?
Yes, I have. I've actually practiced it as well.
Oh, thank you so much. Yes. So for vaginal examination and for dealing with contraction, I will give you a breathing technique that I want you to practice. Keep practicing it. and it will help you relax. Do you do any hypnotizing yourself?
No.
Any breathing? And I know breathing. We sometimes we all just, you see somebody in panic or angry, and then you're like, just breathe. But this breathing, how are we supposed to breathe to calm down and to help our body relax? So during the vaginal examination, if you're able to achieve relaxation, you will not feel it. Definitely it's uncomfortable to an extent of pain. All right? But the first thing is the discomfort. But if you relax, then there will be no discomfort. Pain is dependent on what is happening. For example, sometimes you have opened well, but there is this, we call it a lip. Now the whole of this lip. So there's an upper lip here that is just blocking the baby. And when the midwife comes and feels that you've opened up, but there's this upper lip, he or she may want to push it away. So there will be a bit of pain. But if all is going well and it's opening symmetrically to this beautiful round, then it will just be uncomfortable. Okay? Yes. So we'll do the vaginal examination. Unfortunately, there is no gadgets.
It's fingers.
It's fingers. And the midwife will just do and know and keep, they keep trying. If it's here and you're like this.
This is during or
during labor.
Or not now?
Not now. During labor. And we don't do it without a reason.
Oh, and how come like the Kenya, they were telling me they used to start early, the checking. The nurses that we used to study with, they told me they used to check early, like they start checking early, the finger thing.
I think they used to do it because there in Kapsabet especially, people come when they're already ready to deliver. So when he means early, it means like as soon as they arrive.
Or they start immediately.
Okay. But definitely now, the reason we do this is to know if you're opening up or not. So even if you came in during admission, the first few things that will be done is to feel the heartbeat of the baby and definitely to do the vaginal examination. When we do the vaginal examination, we'll be able to know where are we. Are we still closed? Are we at 2? Are we at 4? Are we at 7? Because now we'll have said labor has begun. And as long as it has started opening, we say labor has begun. So how do we monitor the progress? We monitor the progress by measuring with the fingers. Yes. Okay? So it's actually a good thing. And you will realize, so the heart rates and the contractions are our key pillars there. Okay. Just those two.
The heart rate and the contractions.
Yes. The rest are just to make sure that you're firing your blood pressure here and there. But the two things that everybody wants to know: how are the contractions behaving towards this baby? And are they meaningful contractions that are making the cervix to stretch open and the baby to move? Yes. Okay. All right? Yes.
That's a good lesson, the way we are learning there. So these were our parents taught this? Like, were our parents ever taught things like this, or it's just a modern thing for us?
No, our parents were taught. They taught each other. All right? Like my parents taught them. So probably it was not as dense, but they were taught on how to behave. Like you'd feel this pain, walk around, do this, squat, will be with you there. And you see, when my grandmother tells me when people are giving birth at their place, women would just come and sing and shout and sing and shout, so that the mother who is giving birth, even if she screams, it will not be heard. Because for anyone who screamed was looked at like a weak woman. But there is no, so they they hide each other's buttocks, literally, because they'll come and sing and shout and dance, and you are there screaming and shouting, so nobody.
We are always talking about that with our ancestors, there definitely was that guidance of they teach you of how you're supposed to go.
Yes,
go about. Yeah.
And they are there for you.
Yeah, they're there for you.
So, what do I expect you to do between this and this? What do you think? What are your expectations? What are you supposed to do between this to this?
Definitely, I would love to have a lot of movement, not to just
beautiful
to be in bed.
Yes, yes, beautiful movement. Huh? So we will move around. We will move around. We will use the staircase.
During?
Yes. Before
not like right now. You should be walking to prepare for this.
Even right now, I believe I should be.
Yes, you should be walking even right now.
Okay.
Yes.
But during you'll be doing a lot
labor,
of. So I don't get shocked when I see you're walking instead of being on bed.
Exercise. Yeah.
Okay.
I wouldn't want to be in bed.
Yes.
Personally, also.
And we will not allow you to be in bed because something called the force of gravity.
Just normal lying down.
Not just normal lying down. Yes. So what else would you want to do between this and this? Do you see this is hard work?
Yeah.
Okay, so what else do you think you'll do?
Serious breathing.
Serious breathing, yes. Good job, and you will do it.
Calming down breathing.
A lot of patience with yourself.
Yes. All right.
Seems like it can. If it's the longest more than 9 months, you'll need to be really patient.
Do we need energy?
Yeah.
So that means you will eat.
Yeah, food.
All right. A lot of eating and drinking and going to pee. All right. Yes. What do you think you're going to do for us here? Between this and this. What are you doing for us? Okay, for her.
I'll be there for whatever she'll need. I'll make sure I'll be there. If it's the food, I'll make sure I'll be there. If anything that she'll need, anything that she'll need, I'll just be there. I just hold her hand. I'm sure this is all she'll need to remember.
It will be my encouragement.
Yeah, or what should I be doing when that is happening?
That's why I want it to come from you, then I crown it.
Okay. I think I'll just be there for AANIQA. I don't think there's anything more she'll need. I just need me to be there with her. And not just there, but there with
present.
You. Yeah, present, And feel the feelings, the emotions she's going through so that...
I love that. Yeah. Feel the feelings. Yes.
And just be there for her,
Awesome.
Already you are feeling.
I'm not sure, but I'm really
none of us are sure, but we will go through it. And it will be the best experience. We already know.
It will be.
It's about manifesting the best experience
that
we have.
Yes. Yes. So, we've said what you're going to do, and I'll give you the exercises like we promised.
Yeah.
So, Ian, when she's low, for whatever reason, we are all human, we have this kind of...
the way.
What are the words that you use to make her feel better?
I just hold her. I just remind her I'm there. Just in any way possible.
She's a touchy person.
All
right, beautiful. Don't stop that. So that is one thing that you do not forget to do. Her love language is touch. So please don't forget that, all right?
Okay.
Number 2, I'll ask her. She will confirm and she'll add some more. Number 2, what are the words that you use?
I don't know if it's just to put them, all of them in one bracket, but to encourage, to be very encouraging.
I want those words.
The words themselves.
Yes. Pretend you're encouraging her right now. Definitely. This is an encouragement.
Yeah. For AANIQA and I, we've our journey has been through everything. So we know we can do it. We know we've done it. It's not something that we live our life from death coming back. So we have already lived through this. It's just the experience now that we are acquiring. and sometimes the experiences might be the way you've said, wavy, up and down, but at the end of it all, we've always come out together. And and this time round, our goal is to go back home being 3, and that's what we'll do. And I as always, AANIQA knows I've got your back as always. So she you know.
Let me add some more. Please put on your shoes and come. What music does she love?
She's
reggae, bongo.
Yeah.
I want a playlist, okay? That's yours here.
Okay.
We want a playlist. Just stand up, take your time, just stand. Alright, so so playlist will help us, because there are times that she may want to be baby. So I want you to walk like this. Yes. No, just walk. Okay. That's one. That is one. Then the other one is 2. Round. Good. Round. Your waist round. As far as you can. I want you to feel a beautiful stretch here. Good.
And is it usual for the back to hurt like that?
And it doesn't have to hurt. Some mothers go into labor, their backs don't hurt. Some mothers go into labor and their back.
And during this now,
yes, because
she's really feeling the weight right now.
It's the back that is carrying this weight. So this is beautiful. So probably ear is here. Go round. Let's go round and here. Legs apart. As comfortable as you can. Take your time slowly. So ear is here. Maybe you're doing a good job. I believe in you. You're already past 9 months. We are excited. I am right here. You are doing an amazing job, and I'm so proud of you. I am so proud of you. Then a contraction comes. Let us squat. Here, look at my hands. Up there or just below here, right? Whichever she's comfortable with. Then a contraction is coming. Please squat. I want you to trust me, okay? Let's go down. Let's go down as far as you can. As far as you can, whichever is comfortable. That is where you can. Let's go. There's a contraction.
Is the cloth? Is it the cloth? It's the cloth, like maybe that's what is going. Restricting her to go.
Her leg is okay. And then just stay there where you're comfortable at. That is a beautiful.
So I hold her there. All the weight I hold it for her.
All the way to hold it for her. The other way that you can do it, please come. And these exercises, I want them to start at home. That day, at a gym, legs apart, as apart as you are comfortable. Not very apart, but as long as you're comfortable. Okay, go down. You can even remove the slippers if you think they're making more comfortable.
I should hold her? I can hold her hands here?
With that one now, she's very fine.
Oh. Yeah, you've not put your weight. Like your legs, I think your legs shouldn't, like you're holding me to go down. You can come close so that you put all your weight, like you lean back completely.
Yes. Go. I want that weight here.
Yeah. Good. Yeah, like that.
Alright, I go down.
You can put it straight maybe here so that you stop using your biceps. You just like hang. Wanna get, you wanna clean your biceps up. No, you're not,
Alright.
Maybe move for a bit.
Try, put your weight. Yes, stay there. Just go down, go down. Come on, chuchuma like in those. Yes.
Yeah, evil baby. Yeah.
Alright. If that is too much for you, we can try. We want you to compare with this. And you know what? I'm giving you all these options so that you have them. And you know the body will ask for what it knows. Yes.
Are you really feeling
stretch?
Yes. She'll soon start sweating.
You're feeling the stretch.
The other one is here. So with this, you can hold it and always make sure.
I have a grip.
Yes. Like that. Okay. Now go down. Then for you, what I want you to do, once she's going down, you try to, if this is not comfortable, you can bring it here.
Okay.
All right? Just try whichever you are comfortable with. Make a nice quick good job.
I feel it.
Yeah, that's good.
Okay. Don't mind him, he's strong. Don't mind him, he's fine. Good job. All right?
Try leaning back, yeah, like that.
Yeah, good job, like that.
Yeah, like your core, backbone will go straight. So you should like hold it on your complete.
Good.
Yeah,
like
come
that
in,
one.
yeah.
Come and right here on the wall. The wall can support your back.
Oh, hands like that?
Yes.
Okay.
Let loose. Let loose. And stay as much as you can down there. Let loose. There you go. Does this give you a bit of confidence?
Yeah.
Okay. Stay there as much as you can. That's a contraction. It will take like 38 seconds. Good job. And you stand up. The other way, you can do this and just stay like this. You know? Yes. Try it. Don't worry. Here to this is a lot of work.
No, itakuwa sawa kabisa.
Okay.
I just need to know how I'll be there for her.
Now you see how much you'll be there for her?
Yeah, just knowing how I'll be there for her.
That's a relief, huh? And
Standing
the
like
back,
this,
and the back is not carrying much weight. So this, I know it's a relief. Then when you are at that position, I want us to go like this, slowly, as far as you can. Go back straight. It's just the hips that I want them move. Good job. Good job. Keep going. Give me 7. Good. Rest. I know.
Really feeling it. It's tough.
This one has been a relief.
Oh, that one has
Even
been a
my
relief.
thighs feel nice actually after squatting.
After squatting that one. Then the other one, you can hold him here. Just hold him, Katsan, just hold. We'll do the same. You can. I've had women who are from your side and they have a lot of it. And you know, being extremely light skinned, you're so sensitive even to touch. Somebody touches you like this and
you get to see the
exactly mark. You know. And some come around the abdomen during the last minute. Yes.
They're just rashes.
They're just rashes. The only thing that might be uncomfortable if it's itchy. Kind of if it's after 4 hours, the midwife comes also. We are at 6 centimeters and we are not moving. So what I want us to talk about is something I call the unexpected outcomes.
Yeah.
And they happen, and that is why I discussed it. Okay? So for example, one of the unexpected that is so obvious is the CS.
Yeah.
We are here, we are positively working towards vaginal delivery.
Yeah.
But sometimes things happen. So number 1, what causes an emergency CS? Okay? There are actually 3 things. I call them 3 P's. A P, you know? A P. So you are, like I said, our lead. Okay? So 1, it could be the passage. Alright? So the passage is not progressing. Remember, we want it to be 10 centimeters. So if you are stuck at 4 centimeters, we will start intervening. And number 1 is, why are you having good contractions, but they are useless? They are not being meaningful. Because a meaningful contraction will keep opening, dilating. So probably that's the time you'll hear, can we rupture the membranes? Can we put on fluid? Can we do so that we observe and see?
And this you're asking how? These questions you'll be asked when you're delivering?
No,
No,
this
no, no,
is
no, no.
we
Now-
prepare mentally
Yes,
for
mentally.
that situation.
Okay.
Yeah, for any situation, so that we are on the same page. Remember, our keywords were, we want you to own your birth.
Yeah.
Okay? So, because we want it to be as natural, we want it to be as, it will come on itself.
Yeah.
Nothing, you know. But now, if we are stuck at 4, we will not call it natural. We'll have to intervene.
So, how long would you observe till you decide that now this is...
Beautiful question. Beautiful question. This now depends with so many things. For example, we can observe as long as baby is okay. Sometimes as long as baby is not okay, immediately theater. Because remember, your life is determining baby's life.
Yeah.
So you may even be at 8 centimeters, 8, where the head is right here. We can see the head is right here. But as long as baby is just trying to tell us, please save me, we are going to theater immediately.
Okay.
But on a normal situation, 8 centimeters, give or take within 30 minutes, maximum 1 hour, you should be giving birth. But now if the person is complaining, even a second counts. All right? So give or take, we may not say how long.
Okay.
But it's a situation based to another situation.
Okay.
As long as you and baby are safe and fine, we are never in a hurry to intervene. Why? We trust your body to know what to do. So we will not intervene. We'll only intervene when it is necessary. That makes sense?
It does, yeah.
Okay. So the person has refused to open up to 10 centimeters, and there's no way we can use even 8 centimeters. There's no way we can force the baby out. It has to be 10 centimeters, okay? So the other thing is your passenger. Remember, you're the driver? If one of your passengers starts making noise, what will you do? You'll stop and he or she gets out.
Yeah.
So if baby complains, and that is why it said you keep on monitoring the heartbeat of the baby. If the heartbeat is not behaving as per expectations, definitely it ends up, we will have to save that baby.
Yeah.
Yes. It becomes an emergency.
Okay.
All right? Then, the other one is the passage, the passenger, and the, or am I forgetting the contraction? I give it a nice name, but I'm forgetting. Now, you are having contractions. And these contractions are not even contracting. Yani, I'm waiting for you to that time where a beautiful contraction, I'll call it beautiful because it is bringing our baby, but it's beautiful but you are crying. I want you to keep contracting. The contraction must be longer. They are now coming. After a very short duration, it comes a stronger one and a longer one. But between 4 centimeters to 6 centimeters, I'm still laughing with you. No. At the contraction, it's coming, you're like, it's coming, it's coming, it's coming. It disappears. It fades. No. So that's another way we will intervene. If the contractions are still behaving the same,
we just let it...
we'll just let it go for a CS.
Okay.
All right?
And for inducing, what other methods you prefer to use here to induce labor in case of that situation?
So when you are already in labor and labor is not progressing well, we give oxytocin.
Okay.
That is put in IV fluid and then we put oxytocin. That one helps in progressing. But to some people it also still fails.
Okay.
All right? Kindly note that inducing means bringing labor when there is no labor at all.
Yeah.
Like you're already at 40 weeks. We expect labor to come. Then you come, we tell you, nah, you're fine. Let's give it 5 days. Then you go, you still come, labor is not coming. Now that is when you're going to induce.
Okay.
all right? And induction, we use a pill, a very tiny one, that we put under the tongue. And that one you are monitored throughout.
Okay.
Good thing is, one, if you're given the first pill and labor picks, no more pills.
Okay.
Natural now. Because you trust your body. Probably just needed kushtuliwa tu kidogo, just a little bit. Some mothers get the first dose, second dose, third, fourth, up to 6.
Okay.
If we get to the 4th, most of the gynaes that I work with, the 4th, they're like, this is the last one that I'm giving. If the body is not responding, we'll just go in. CS. Or sometimes they say, if I get to the 6th and it is not there, 2 ways. I'll either let the mama rest, if completely no pain. I can let the mama rest, we restart again.
Okay.
But from my own experience, the restarting will still do the same. It will still fail. So with that, it's failure of induction, and we go in.
Okay, so that is only for delayed labor.
Delayed
the
labor.
Induction, the inducing.
Yes, the inducing. Yes.
Okay.
So we induce
And
it.
what
That's why.
in case of CS, though we are completely positive about
Oh yes,
delivery
oh
will
yes.
go
This
well.
is just now knowledge.
Just to know.
Yes.
What hospital is it that is linked with the
Amber,
clinic? Yeah.
we go to
Haley.
Former Maristops, you know Maristops? Former Maristops?
We're not very familiar now.
Okay. It
It's
is just a stone throw here.
okay.
It's just
Close by.
very close by.
Okay.
Yeah, that's why we chose on there.
We trust the clinic, so
We do.
that is okay.
Oh yes. That is where you go. Beautiful thing. We go with our own doctors,
Okay.
our own nurses. We are just going to borrow the theater, and we come back.
Okay.
Yes. All right.
Okay.
So that is in a nutshell all about labor and everything in between. Yes.
So for when we are having during our labor in our room, we can just request for privacy, just doula and midwife, not many.
Yeah. The best thing is that here we do one nurse
Yeah.
per patient.
Okay.
So once you are in your room, not unless otherwise, the only people who will come in your room is when they are shifting from the night nurse to the morning nurse.
Okay.
They will, both of them, they'll come, reintroduce themselves, and leave.
Okay.
So from there on, we have a very lean staff,
Okay.
and we
Yeah.
like it that way.
We also feel it's very homely, the vibe here.
Ah.
It feels like delivering at home. Yeah.
Yeah, yes. All right. So that is unexpected number 1.
Okay.
Unexpected number 2. What do you think? What else is unexpected?
In
That
terms
you've heard, you've read, you've shared, you've heard some mamas discussing
bleeding, yeah, excessive bleeding.
Huh? That may end up warranting us to give you some more blood, or that will just be arrested. All right. So yes, those things do happen, though they are not common, but they happen.
Okay. And
all right.
in case of the umbilical cord surrounding baby's neck.
No, those are things that affect your passenger and will make us go.
Okay.
Yes,
Those are
yes.
what lead to CS.
Yes, they're affecting your passenger. All right. Yes. Another unexpected.
Do you have any in mind?
Stillborn.
Yeah, stillbirth. Oh yes, stillbirth do happen. We labor, nice. The last minute, everything is nice. All of a sudden, baby is born, no cry. And the last person who had a heartbeat, that thing scares everybody.
Yeah,
Every you start doubting your machines, you start doubting yourself. Like the colleagues are, no, who was, but sometimes it just happens, and yes, it does happen.
So you can be monitoring and you're hearing the heartbeat, and right after labor,
1 second, just 1 second, things just happen. Yes. Right? Yes, that one can happen. And the opposite is true, maternal death.
Yeah.
The opposite is also true. And the how we have done so that we are at par is making sure that we are in very good relationship with other hospitals.
Yeah.
You know, and we can. I remember the last time we called an ambulance, and then I thought they have overstayed. They just took my car. It was a baby. I rolled, picked the baby, put the baby in my car, and went. I just told the dad, "Come with me. Your wife is fine. The mother is fine. You've seen she's recovered. Let's go with you." So we went with the baby and the father to JTRH. It's a public hospital, and we put the baby into the ICU. Baby was on oxygen, and baby survived. So some of these things, if you wait for an ambulance,
it's not
and their vehicle, let us do explanation later. Let us say why we couldn't wait for an ambulance, but sometimes we do such things. Not ethically right in the medical field, but sometimes you feel like this baby's gonna make it.
Yeah.
But then if I waste a second,
sometimes it needs to be done.
You know, I'm like, I will explain later. If this gets me into problems, I will explain later. But the best thing, I have the father with me.
And baby is safe.
The baby is safe, all right? Yes. Another unexpected, I think I mentioned. You've done an ultrasound. You are told the sex of the baby. Oh, lo and behold.
No, man.
We have seen it. Oh, we have seen.
But boy is sure.
Yeah.
Eh?
Boy is sure. And like girl, probably you think it's a girl, then it's a boy. Not you think it's a boy, then it's a girl.
Because when it comes to boys, at least they look at the penis.
Yeah.
Yeah. Right?
Yeah.
So the penis is usually very small like this. So if it's not seen, the scrotum is like this. So they see the scrotum, which looks like the lips of the vagina. It's very confusing. Yeah.
You can't get confused.
Oh, yeah.
It's very confusing.
Yeah.
You know that scrotum has that line.
Yeah.
All right?
Yeah.
And so is the vagina. The two lips are tightly together like this. So, picky ponky, we can tell you what.
Yeah, you're scared, yeah.
Let's just hope it's
You know,
okay.
so having an open mind is what we want.
We were actually expecting a girl till we found out
Till
it's
you
a
find
boy.
a boy. Yeah, so somebody may go home smiling extra. And for the first time parents, I just like, yes, I know all parents, all we want is a healthy baby, healthy mommy. But I think the most unfortunate is the one that they are 4 boys. Then this one, they were told it's a girl, and finally it's a girl. Then they give birth, it's a boy. No, that's the time you forget about being healthy.
Firstborn is different.
Yeah, firstborn is very open-minded, you know. Yes, okay. The other one, I think we talked about it, is when we were saying about that money that we need it in the back pocket,
emergency.
Financial arrangement. Then I know you're very organized, and so far really much, I have a lot of respect for you guys, and I know you've already, if you're believers or whatever, you've already chosen a name that is powerful. And let me remind you that there is power in naming. There is power in naming. Right? Yes. And the most unfortunate thing right now in Kenya, once the names are endorsed in the birth certificate, you don't change. Yeah. For me, I feel it's so wrong, because I've seen parents who named their child somebody who was just a father to one of them and maybe died and had very bad behavior. Then the kids start showing some things, and now they want to change. But unfortunately, they can't change.
Yeah.
You know? So the name that you are agreeing on, bless it, manifest good things with that name. Start calling our baby with those beautiful names.
We manifested our name a while
Beautiful,
ago.
you know? And moving forward, when you are talking to the baby, talk to the baby with its name. Right?
Yeah.
It's powerful. There is power. There is power in naming. Okay? You also talked about circumcision, but you want it to be done.
Not immediately.
Oh, not you guys.
No. I don't think we discussed that.
Okay.
Though, yeah, it is.
It is something we should discuss.
Okay.
Yeah.
Yes.
Yeah,
so
but we
family. I call them family values.
Yeah.
So when it comes to family values, one, we have circumcision. You'll agree. You'll discuss and see. Even the naming is in a family value. The other family value is baptismal. If you're Christians, some people like it when they baptize the kids when they are still young. Some they dedicate the children. I mean, we all have a belief somewhere.
Yeah.
So that belief, are you planning to integrate it with your baby? Because fortunately or unfortunately, some of us don't come from the same religion.
Yeah.
You know?
Yeah.
But we are already in love, we are already here.
Yeah.
So what happens to our baby? Will the baby go to this church? Will the mother this church?
Good. You know, by the way, maybe if we've never mentioned to you, we've been together since high school.
Yeah.
Yeah. So
You did? Oh my good Lord.
Yeah, 15 years now. Yeah. So it's something that we've really discussed on length.
Kisumu.
Yeah, Jalaram. I went to Central Primary, then I went to Jalaram is when I met her.
Is where we met.
Yeah, Jalaram Academy. And that's where, in Milimani, I don't know if you know it in Milimani, and that's where we grew up. I grew up in Milimani and I came in Milimani.
Yeah.
We went for studies,
Baraton,
Eldoret, and is when we just came back. Is when we got married and we got married last year after is when AANIQA's dad gave us the permission.
Okay.
Yeah, is when we got married. But it wasn't approved from them. Since we stay in Kisumu, it's not approved from the family.
Yeah.
They just gave us the permission to wed, not the permission to stick with the family. Now it's more like it's just AANIQA and I.
We are our own family.
Yeah, disowned. More like disowned, yeah. So that's why you see we do not have
those guidance or any sort of information in any way.
Okay. And here you are gonna make perfect, very good parents.
Yeah.
Thank you. And thank you for bringing me closer to that family. All right.
So
yes, I know Jalaram. My boy is in Jalaram.
I was just your reaction did hint that.
You know,
they must
this is beautiful. It's a beautiful love story. And your YouTube channel is called?
It's called Rasta Pakistani. We'll leave it for you. You'll just see.
Oh yeah. I think you mentioned it, and then
she's Pakistani and I'm Rasta. So if you just write YouTube Rasta Pakistani,
Okay. Oh wow, congratulations. You guys stood for each other.
Yeah.
And the values that you believe in and definitely the love that we between
So we have created our own values for
Yes, and that is it, and that is it. And this is a good reminder that once whatever you've come up with, now this baby is coming, white as snow. White as snow.
Yeah.
Whatever this baby will pick is whatever we have given this baby.
Yes.
And it just takes the two of you. Just the two of you.
We already know he's a very strong character. Just as you say,
the name.
Name has a lot of value, a lot of power.
We got the name, like if we've been together 15 years.
I can imagine.
Yeah, the names have been there, even the amount of, the number of kids. So we've always, all these were pre-planned long time.
Why do I love it so much?
It has been, it has been crazy that we did get blessed with exactly what we had planned for.
Yes.
And it's nice, but it's not also been very easy to get here.
It's not been easy.
Yeah, when you go to our channel, maybe when you have time is when you'll see. This channel has our story that if we're to tell you right now,
it will take forever. But then again, you see, this also means so much to me. Not that I don't treat all my clients equally, but there are those clients that will always give us salt. You know, there are those parents who will, or a couple who will make you not have a doubt of why you're existing. You know, like you are there, you are family, you know, and this is exactly what I'm feeling about you guys. Like it is now more than business. It is that phone call of, I wouldn't want to miss. It is because now who else do you call if I'm not there, you know? Is that family that I feel now, even if I usually tell my clients, I will be away for this duration. But now this one is different because I'd almost want to know, do they have food? Do they have...
Yeah, we do feel the same with you. It's
you know?
like a family.
Yes.
You have come to represent that what is missing for us.
Yeah, and we really appreciate it, especially for the sake of our son. Yeah, we appreciate it, and we will make sure they know how you are there for us today.
I truly do wish we did find.
And they will see the videos. They will see the videos.
They will see them.
They will.
Yeah.
So
and it has begun, so it's gonna go.
It's going to last
It's
now.
going to last.
This is one of many. We are planning of 6. So here is just 1, 5 more to go.
You know?
Yeah.
5 to go.
Yeah.
And you don't know, you might end up having, the next will be 2 or 3 in one.
Yeah. We are open-minded. We're open-minded. Yeah.
Beautiful.
The blessings will let them come.
Yeah.
All right.
Yeah. We really appreciate the hand of support you give to us, because it's something. Yeah, it's something. When you I think when you watch our channel,
You will understand.
Yeah.
Okay, I'll do that.
Even mentally, you've been a big support for us right now. To have you, it's
Asante.
Thank you.
All right.
Thank you too for not for not looking at us the way other places they look at us when we walk in. Yeah. So really, we appreciate that a lot. Yeah, because the first impression of where we get is why you see there's so many medicines we stopped with them, because it was these hospitals. It was the impression that we were like, no.
When people stop being human, you get that a lot.
Yeah.
When people are looking you expecting this, but they find out you're like this, no, we should be very open, and I'm happy for you. Now, I think we are done. If labor came right now,
if labor came right now, we would give you a call.
Good job.
And
we'll come immediately.
Have you started packing?
I've not started.
Yeah, we had a question also of what exactly do you think we'll need? Is there some do we just need one cloth of baby only, or like one cloth, one towel?
No, alright.
I've already told to pack.
Oh, there's a list. Okay.
3 days in advance.
Okay. So the list would be really helpful.
But you have shopped?
Yeah, we have everything is prepared. Clothes are ready. We have everything.
Everything is ready.
Unless there's with the list you'll give us, we'll know if there's anything else left to take out.
Alright.
We will get that done this week, but otherwise everything as per what we had known is prepared.
Okay. Probably it's already done. The only thing that I really like is insisting on the sizes, so that you don't buy too tiny. For between 0 to 6, this baby sprouts. So if you have 0 to 6 or 0 to 3, that are quite a lot, they will not wear them.
Okay.
You'll be moving now 6 to 9, and you leave a lot of new.
Actually, our clothes are. We don't have a lot of small. We have very minimal, probably 3 or 4 suits for newborn, which we will be able to come with. Then the rest go from 3 to 6.
Do we need to come with a cloth on the first day, or just something to wrap, like a shawl?
No, they need a cloth.
They will wear a cloth. They don't remain like that.
No.
Okay. So it's those soft clothes that we have.
Yeah, that completely small, soft ones.
And those ones we carry 3 of them for 3 days.
Yeah.
Okay.
And you carry one. Out of the 3, please get for me for newborn, and then 0 to 3.
Okay.
Yes, I see a very tall man here.
0 to 3.
I will not be surprised.
If the newborn doesn't fit, okay.
Yes.
We'll come.
So just carry at least one that is a bit. But the best thing, even if they are born and they are tall, they stay in this position. So even if you dress in like a small mini,
but just in case, we will make sure to carry them.
Yes, just carry. And when you're packing, even after packing, probably one of these fine days, if you need me to pass by the house and just see what you have
I think
packed,
we would appreciate that.
Yes, I can always pop in.
Okay.
Yeah, this week we plan for this weekend.
Yeah, we can plan for this
weekend. Yeah, this weekend. Once we are done with the other checkup, the Wednesday one, then weekend it will be the next meeting.
By then, I think even you would have sent us the list, so we would have cross-checked and made sure everything is in order.
Okay, then that is fine. So we end.
Yeah.
On Wednesday, we are finishing with the exercises.
Okay, so it's just checking the
rooms and the...
Yes, it's just checking the rooms and your results.
Results,
And your results.
Should we be worried about the results?
No, I could have called you.
Okay.
We have been.
Yeah, I asked AANIQA earlier, and we just were very worried.
No.
Yeah.
If you didn't see the hospital calling,
Okay.
you are good to go.
Okay.
Especially because of the diabetes in the family. That is normally a worry in our mind.
Is
my mom. She's diabetic.
Okay. At how old? At what age?
She found out at 40.
Oh, at 40.
At 40, yeah.
What's her lifestyle like? Is she an active person?
She's active, but not excessively. Not excessively active.
What does she do for a living?
She's a housewife.
Oh, she's a stay-at-home mom.
Yeah, she's a stay-at-home mom.
Okay, so just usual errands.
Yeah, she does move around a lot outside, but she didn't start that lifestyle earlier. She started it when she got old.
Okay.
Yeah.
Okay.
So it already caught up with the diabetes.
Yes. So. All right. Okay. Yeah, because diabetes and hypertension.
Behind this normally.
The baby was being born.
He was born here.
Yes, he was born here.
Hey. But you were okay.
And Christian tried not to be the midwife, but to be the husband, but he was all over.
So it's a good time we've come. Christian is still fresh from.
Yeah.
Nice.
It's nice to have seen him.
So that's our male midwife. Also just had a baby 3 months ago. So we are actually also a boy like us.
Yeah, prince.
Yeah. So we are really.
It's a prince. Yeah.
The universe is telling us it was the right decision.
Yeah, we
feel
what we felt here. It was correct. We are happy to have found. It's
and
so
to have
hidden.
been patient. We were patient not to jump to the other ones that we had.
Yeah.
Patient. So we're just going to take our results and we'll be heading out now.
And to see the rooms. We're going to see our delivery room.
Oh,
Let us just mentally be able to picture ourselves in the room.
Yeah. You really wanted to see the rooms?
I really want to see the room, yeah. Here feels homely.
Mtoto amefanya nani? Mbona anageuza sura hivi? They grow so fast.
They do kweli 3 months.
Imagine. Hi, Babu. Hi, Babu. Anatamani kuketi.
Tena sana karibuni.
Okay. Sasa hapa ni labor room.
Okay.
Vile unaanza. Naanzia hapa kuna some exercises zenye
Tunatoka guidance.
Nafanya.
So hapa ndo tunaanzia hapa ni place ya kurest kabla delivery. Delivery room ni different.
Oh. Nilikuwa dhani ndo delivery.
Yes, labor.
Ni labor.
Oh.
Ukitoka hapa
So this is labor room.
Delivery room. Okay.
Delivery room. Nice. Wow. Wow.
hapa unatanikiwa basi.
Na mtoto anakuja. Tunaanza kusherehekea.
Tunasherehekea kuimba basi.
Haya, sawa.
Mtu anatolewa hapo, anawekwa hapo.
Oh.
Na nguo zake
Anavalishwa,
anapanguzwa, tunampanguza vizuri na mbalisha.
Are you ready?
I'm ready.
I'm so excited.
Tutakuwa hapa na rispa mom, tutakuwa sawa, si ndio?
So hapo hivi akilala analala aje? Mguu hivi. Ama ikitanda inasongezwa huku.
Sasa hii kitanda iko tu hapa. Hapa inabebwa juu kidogo.
Oh. Oh. Oh.
Sasa daktari anasimama hapa. Na mimi rispa niko hapa.
Oh.
Hata wewe unakuwa hapa.
Oh. Sawa.
Ngojea mgeni.
Sawa. Yeah.
Tunaambizana huko. Nakuja wapi?
Delivery.
Okay.
Now here postnatal. Is once we've had our baby.
Washroom.
Oh, nice. Wow. Wow. Kumbe ni fiti hivi. Wow. Guys, look at the bathroom.
Na yeye akilala na mimi hapa hivi anapumzika.
Haina shida.
Tunapumzika tunawe hapa. It's nice. The GoPro has gone off. Wacha nitatumia simu. Nice. Hii place iko poa sana. Iko poa sana. Kwanza venye hii space iko hapa hivi. Kama mzee anataka kuleta sigara yake anaweza kulia hapa.
Unapumzika hapa.
Niko sawa kabisa. Imetulia. Hakuna magari zinapiga pi pi pi. It's really nice.
Funny place, peaceful sana.
How was it? You found it peaceful?
I love it.
Sindio?
Yeah.
Mzuri sana. This is the bathroom. It's really nice.
Really nice.
Tumependa sana sana sana. Kwanza venye ni private hivyo. Asante sana. So here it's the postnatal. Then delivery. Then labor. Really nice. Bath code conduct. Always enter the bathing space quietly. Watu waingie pole pole. Tusiongee hivi na nguvu venye tunaongea.
Close it, baby.
Wacha tutumie hizi zenyu ndo ni safi. Zetu zimetembea nje.
Tumeshukuru sana mama, tumependa sana.
Sana.
Na mnakoga hadi na water bath. Hizi za
Wewe umezaliwa kwa maji?
yeah.
Kama ni picha tu.
Hiyo tunazo.
Lakini ni kwa maji hiyo.
Please change it to Crocs.
Yeah.
Next time tukirudi hivi. Change it to Crocs.
Crazy love.
Yeah.
Tutakuwa tunasemeka hivi tukiwa watatu. Really nice. Christian, iko poa sana. Yeah, it's really nice. Tulikuwa tunadhani ni room moja, kumbe ni tatu different.
No, there are 3 for every stage.
And that with other hospitals ziko hivyo pia?
Yeah.
Ziko hivyo tatu?
Those separations.
Because
you can't have someone when
delivery there.
That level. Looking at us.
Hata panic.
Yeah, panic now.
Safi. So ndio hiyo payments hapo hivi. That's our book.
That's all.
Iko chonjo? We are done.
Yes, leaving now.
Stepping out.
Good.
Asante sana. Safi. So guys, that's it. So until 17th for our next meeting.
But Wednesday we are here
Yeah, Wednesday for classes. Those are classes here.
to meet Doula.
How are you, my wife? Let me take you get the lunch quick first we go.
Thank you. We have seen the rooms. I'm really happy. It feels homely.
What's your leg?
Okay, yeah, it's inside. Let's go. Let's go get something to eat. We go get something to eat. How do you find it?
Here. Very nice, very nice. And I'm the one who was very worried about where my kids need to come.
Yeah.
This is a nice place.
This is perfect for us. Okay, let's proceed with our journey.
We are knock or hoot.
Yeah. Maybe there's something that rubbed off.
Asante sana.
So let's continue. Let the journey commence.
Yeah, so guys, that's how the hospital we close it here.
Yeah, that's how. So those were some more lessons.
So we've done labor, we've done some classes.
We've gotten an injection. We've gotten a blood group test. We've done a few things. We've gotten blood group test, classes. These classes are going to go on till after delivery. So if you are ever needing someone to guide you through your labor, your delivery, your aftercare for baby, this is an option here. You can get the doula. The doula she's very friendly. She's willing to guide you till at home. She's willing to come home and to give you the lessons at home. So that is what our today's day was consisting of. We got to see the rooms. The rooms are really clean.
They're really nice.
I can see us. I can see us giving birth here. I can picture us going back as 3. Very homely. The reason.
Very nice shower.
Yeah, very clean. Yeah, very nice bathroom, very private. It's not too busy. As you have seen, this is our second visit here, and it's been very private, very homely. As you know, tribe, we had already wanted to have our delivery, have our baby at home, so this is basically the same option for us, just with more safer care, with more professionals to be able to guide us through. We haven't yet met the midwife that will be there with us, but they're going to, yeah, the female midwife. We're going to have a female midwife. For now, the male midwife is just taking us through the care right now, but there will be a female midwife. They are more mature in age, they are elder, they've been serving at this clinic for longer, so those are the ones who are going to take us through our delivery as well. They discussed with us in case of any emergency, which we are very positive with our delivery, but just in case of any emergency, it's good to have your mind open, to be mentally prepared. For first-time parents, this experience is mostly to share with you. As much as it is for us to document, it's also to share with you, because a lot of this guidance, many of us walk through this journey without this guidance. The ones who don't have parents by their side, or any elder person who has experienced this is for you. So we hope you also got to get something. We have been learning. I think we're ready now. In the second round, we're okay now. Yeah. So this, so much. We've learned so much, and we're still learning more. So let us catch up with you guys on the next visit here in a day, which is Wednesday. We'll get to know some more exercises. For now, it's a peace. Third part, no.
That part, we thought our cups ahead, man.
The video.
And Mazi have fucked up my DL, seen a DL, so normally. Yeah, imagine that's how tough today is for you guys. Faster in this our generation than previously. Actually, their maturity level is going down with the years. Like the younger they are now, the mature they are.